If you're over 60 and you take daily supplements to protect your heart, your brain, or your energy, you might want to double-check the label because there are 3 common vitamins, yes, vitamins, that can actually increase your risk of stroke when taken in the wrong way. And most people have no idea. I'm Dr. Thomas Carter. I've spent over 30 years helping older adults prevent stroke through lifestyle and nutrition. And today I want to share the truth about 3 vitamins I tell my patients to be very careful with. Let's get right into it. Vitamin 1, vitamin B6, toxic in high doses. You might be surprised to hear this, but the same vitamin that helps support your nerves and energy can actually damage your nervous system if taken in high amounts. I'm talking about vitamin B6. In small doses, B6 is essential, but in large doses, especially from supplements, it can cause tingling or numbness, burning feet or hands, loss of balance, and in some cases, nerve damage that mimics stroke symptoms. One of my patients, an active man in his 60s, came in after losing strength in his legs. He thought it was a pinched nerve. Turns out, he'd been taking over 150 milligrams of B6 per day for over a year. The recommended amount for adults over 50 is just 1.5 milligrams per day. Even doses above 50 milligrams per day long-term can start causing problems. The worst part? You can be overdosing without knowing through energy drinks, multivitamins, and brain boosters that all contain B6. If you've been feeling odd tingling, balance issues, or muscle twitching, it could be too much B6, not a circulation issue. Have you ever taken a supplement that made you feel worse instead of better? I'd really love to hear your story. Drop it in the comments. It could help others. Vitamin 2, vitamin E, thin blood, higher bleeding risk. Now, this one really surprises people because it's marketed as a heart-healthy antioxidant. And in small doses, it is. But when taken in high amounts, especially over 400 IU per day, vitamin E can make your blood too thin. That increases your risk of bleeding strokes, also called hemorrhagic strokes. Vitamin E interferes with vitamin K, the nutrient your body uses to form clots. And when blood doesn't clot properly, even a small vessel rupture can lead to bleeding in the brain. This is especially dangerous if you're already taking blood thinners, like aspirin or warfarin, you have high blood pressure, or you're over 65. I had a patient once who doubled his vitamin E dosage because he thought more is better. A few months later, he experienced a mild brain bleed after a fall. The neurologist's first question was, is he on any supplements? He was. I'm not saying vitamin E is bad, but you shouldn't exceed 200 to 400 IU per day unless your doctor tells you to. And never mix high-dose vitamin E with blood thinners without medical guidance. Do you think most people overuse supplements these days, or are they still essential for health after 60? I'm curious what you think. Vitamin number 3, folic acid, synthetic B9. Double-edged sword. And finally, let's talk about a vitamin that's often added to fortified foods. Folic acid, the synthetic form of vitamin B9. Now, folate from real food like leafy greens or beans is great. It helps reduce homocysteine, an amino acid that increases stroke risk when elevated. But here's the problem. Most supplements and fortified foods don't contain natural folate. They use folic acid, a synthetic version. And not everyone's body can convert it properly. What happens then? Unmetabolized folic acid can build up in your blood, and recent studies suggest it may suppress your immune function, mask vitamin B12 deficiency, and increase risk of certain stroke types, especially in seniors. One major study from 2020 found that high levels of unmetabolized folic acid were linked to increased stroke risk in older adults, especially when combined with low B12. That's why I always recommend getting folate from whole foods when possible, or use methylfolate in supplements, the active form, and making sure your B12 levels are tested if you take folic acid regularly. Why are these risks overlooked? Here's the truth. The supplement industry isn't regulated like prescription drugs. You can buy megadoses of B6, E, and folic acid, no questions asked. And most labels say things like supports heart health or good for aging, but they don't mention the risks of long-term use or stacking multiple products. In my clinic, I've seen dozens of patients who are taking 4 or 5 supplements with overlapping ingredients without ever realizing it. It's not your fault. The marketing makes it confusing. That's why I'm here, to give you what the labels don't. Should supplement companies be required to warn us about stroke risk on their labels? Let me know what you think below. Okay, what do I tell my patients instead? If you're concerned about stroke risk and supplements, here's what I recommend. Number 1, food first. Most people can get enough B6, folate, and vitamin E from food. Number 2, choose active forms. For folate, look for methylfolate, not folic acid. For B6, P5P or pyridoxal 5-phosphate is safer at lower doses. For E, use food sources, nuts, seeds, olive oil. Number 3, watch for stacking. Don't mix multivitamins plus energy drinks plus anti-aging blends. Read labels carefully. Number 4, test your levels, especially B12 and homocysteine. Imbalances can quietly raise stroke risk. I've seen how devastating a stroke can be. It takes away independence, mobility, sometimes even speech. And what breaks my heart is that some strokes are preventable. If you're doing your best to stay healthy, I admire that. But sometimes less is more, especially with supplements. I don't want you to stop taking vitamins altogether. I just want you to take the right ones in the right way. Here are the 3 vitamins that may increase your stroke risk. Number 1, vitamin B6. Toxic in high doses and causes nerve symptoms. Number 2, vitamin E. Thin blood and increases bleeding risk. Number 3, folic acid, synthetic B9, that can build up and interact with B12. Take care of your brain, take care of your blood vessels, and don't believe the myth that more is always better. Want more tips like this? From a doctor who cares about long-term health, not hype? Hit subscribe so you don't miss future videos. Thanks for watching. I'm Dr. Carter. Stay safe, and I'll see you next time.